dead end. We can solve it. Whether the count is very poor, or if the sperm morphology is poor, sperm DNA fragmentation is high, we can tackle it.
Great. Definitely. So, because the current advancement in medical sciences, I'm sure it has been very, very helpful to millions who have been trying to conceive, and that is definitely a boon. Thank you so much for explaining the treatment options so easily. I'm sure we are having a lot of audience who are joining us and watching our video right now. Thank you everyone for joining We Talk Do You show by P2M, initiated by Human Biological Institute. Though for those who have joined, I would request please put your questions. The session is still on, and we have more interesting discussion coming up with Dr. Nayar. Sir, before we move on to take up the questions from our audience, we would like to ask another major query that is currently streaming up. That is, as far as the COVID-19 situation is concerned, as of now, what is your suggestion to the couples or specifically males? I mean, what should be their the decision, like with the vaccinations coming up, and again those who were in between the cycles, or those who are trying to come out and meet an infertility specialist when they're trying to conceive. What is your suggestions to them?
You see, about the COVID, there have been a lot of discussion since last year when COVID thing came up. Once it came up last year in the month of January or so, we were not knowing how it is going to affect us, affect the males or affect the females. In course of time, we understood the disease, understood the effect, and the many guidelines have been there, which have been which are getting updated repeatedly. Right now, what we are saying is, if a male is infected with COVID, has developed COVID infection, he should at least take a break of almost 3 months before
Okay.
attempting a pregnancy. You see, this was 1 month initially, then reports came 2 months. Now, most of the centers, they are advising that if a male has a COVID infection, he should wait for at least 3 months before attempting a pregnancy. As far as vaccination goes, there is no problem. You can have a vaccination, and if you don't have any side effect from the vaccination within 1 week, you can go ahead for your fertility treatment. You don't have to wait. But the problem was that if a male has COVID infection, they have found out now that you can have COVID virus even in the sperm, semen also. It has been discovered in the semen also. Whether it is causing any effect on the baby conceived, we don't know. But it has been found that it can be there in the semen, in the testicular tissue also. When these patients went for treatment, they have found out the virus in the testicular tissue also. So this COVID virus can be anywhere in the body, you see. So best thing is, if a male has had a COVID infection, take a break. Take a break for 2 to 3 months before attempting a pregnancy, so that the things are totally cleared out of the body. And vaccination, go ahead. There is no issue. The vaccination, just a rest for 1 week or so, that is more than enough, and patient can continue the fertility. And you see, there are very clear-cut guidelines about the COVID infection during treatment, when you're giving treatment or before treatment, what the patient has to undergo. They are very clear-cut guidelines. All the patient has to undergo a triage. All the patient has to have a negative RT-PCR here in the beginning of the treatment, and also negative RT-PCR just before ovum pickup. So you have to follow this guideline, which have been very well established. So you cannot say you are not aware. You have to be there.
Thank you so much, Dr. Nayar, for answering those questions of ours. I'm sure everybody watching this video today would have benefited from this. It's a request to all watching this video. If you think this will be helpful to your family, friends, or someone who's in need, please do like and share this video with them. Now, with your permission, Dr. Nayar, can we take a few questions from the comment section, please?
Yeah.
Yeah. So we have a lot of questions coming up, sir. Okay, the first question, I think Dr. Nair has already informed that somebody is asking, considering the current lifestyle, up to how many years a male remain fertile?
Male can remain fertile till male dies. But the issue is, anybody who is more than 50 years, the sperm parameter will change. Sperm count, sperm motility, sperm morphology, everything will change. So you have to be careful. There are more chances of sperm DNA fragmentation happening in an older male. So the chances of producing an abnormal baby are higher when the age of the male increases. Same if the age of female increases, same with the age of male.
There's one more question that one of my cousin was treated for cancer. Now, after 5 years, they are planning for kids since 2 years. His age is 33 years. How does this impact him for having kids?
It doesn't impact. You see, it all depends if he had a cancer and before taking treatment for cancer, if he had kept his semen frozen. That is what most of the people are doing now. Anybody is going for cancer treatment, the cancer specialist tell him go to an IVF center, go and freeze your sperm. Before starting treatment, before starting chemotherapy or radiotherapy, they will freeze your sperm. And sperm can be frozen easily for years in this thing. Once they are through with their cancer treatment and they are free of cancer, say 5 years down the line, they can use their frozen sperms for achieving further family. They can increase the family. So that is the one. Have we have to be aware before taking cancer treatment that they should be able to freeze the sperm. Similarly, for the female, they are supposed to freeze the eggs also.
Right.
This is what we're doing.
Great, sir. Now, sir, can the prolonged use of steroids cause male infertility?
Yeah, definitely. This use of anabolic steroid, testosterone, all the derivatives, they will decrease the sperm count. They will totally decrease the sperm count. And most of the people are prescribing this testosterone for the building of the muscle. You see, six pack and all those things. But in the process of making six pack, the sperm count become hopeless. That is the issue. So one has to be very careful. If we get young boys who get married and come back with infertility with when we do a semen analysis, zero sperm count.
Right. Now, sir, can carrying a laptop on the lap for a longer time due to work can affect
Like
fertility?
we always tell the males that don't put your laptop on the lap, put it on the table, and then you can use it for as long as you want. When you put your laptop on your lap, you are the heat and radiation is getting down to your testes, you see. And why to expose testes to a higher temperature, a radiation element? Why? So better to put it on a table top than use it.
Correct. We'll take up this last question, sir. Does immunity have an impact on fertility? I think they want to ask whether the vaccine-induced immunity for COVID vaccine can affect fertility.
Generally speaking, I say most of the reports will come that you can take the vaccine. There is no problem with your fertility. You can take the vaccine, and if there are no side effects from the vaccine in the next 1 week, no temperature, nothing, you can continue with your fertility program. There is no need. There is no problem. So
Great.
vaccine will not affect your either the male sperm count or sperm motility or no. Vaccine will not affect. Similarly, vaccine will not affect the female also.
Thank you so much, Dr. Nair, for answering that. I think that was the most running around myth all across. So, guys, please do take your vaccinations if you are getting your slots. It will not affect your fertility. That's a complete myth, as Dr. Nair has also confirmed. So, with this, Dr. Nair, I think we have taken the questions. We still have a lot of questions in the comment section. We would like to, some of them have already been discussed during Dr. Nair's session. He has already discussed during his talk. If you have any more question, you can still write to us. And you can visit our www.pubertytomenopause.com for more information. With this, I would sincerely like to thank Dr. K.D.Nayar for your time, sir. Thank you so much for joining us today and addressing such an important topic, male infertility, and Father's Day coming up day after tomorrow. I'm sure it would have given a lot of hope to many who will be watching our video today.